Well, what is the role of flax in cataract surgery? It's been, praised by some, it's been cursed by most of the people and called it's a total gimmick, doesn't work. Let's take it through. What does flax do? It can do excellent CCC, can soften the lens, can do absolutely brilliant LRIs. It does reasonably good corneal incisions. That's the story so far. So is it useful? Does it add value? Does it increase or decrease the surgeon's skill? Is it really useful to the patient? Again, the doubts are, at both extremes, it doesn't work. That's what the general understanding. It doesn't work in hard cataracts or mature cataracts, and it's not necessary for soft cataracts. So we'll look at every one of these things. So, where's my video? Video's not coming up. So yes. No, we jumped many videos. There's only one that's coming up here. So all the rest are not showing up, I think. On your left-hand side is one where we've done a flax. On your right is similar kind of cataract where no flax has been done. Run both videos simultaneously. Run both together. Second also will run. So you'll find that all the activities on the flax eye is simpler, while I'm still struggling with the other one there. Separate so easily. As I separate, you find small bubbles coming out. What does that signify? That the laser penetrated through that hard, mature cataract right down to the bottom, and the bubbles are coming out from the bottom. So again, separation is so easy, while I'm struggling there on the other side. It takes much more effort. Here, simpler, as well as the lens has been softened. So outcomes. So see the way that the lens separates and comes out in the flax, while here it doesn't separate at the bottom because it's really sticky. One has to spend a lot of time. No harm, fine, you can still do the surgery. But what is wrong in making the surgery easier for yourself, safer for the patient, and giving better outcomes? Should you have to struggle, and just because the technology is not widely available, is expensive, not affordable, is that the only reason to deride the technology? That's a question to be answered. If you ask me a question, is the cost that we are putting up on the patient justifiable for the results? It's a difficult question to answer. But is it better to the patient, better for the surgeon, better outcomes in the long run? There are no two things about it. You'll find here the surgery is over much quicker, while I'm still struggling at the other end to complete the surgery. So let's go to the next slide. This is what shows up. Next morning, the eye that underwent flax, no SK, absolutely fine. The eye underwent flax, SK is there, 618, yes, in about a week's time it will get better. But definitely endothelial cell count has gone down. How much it went down by, we do not know. We've operated probably on a 65 or a 70-year-old person, and if he's going to live another 20 years, is he or she going to have endothelial decompensation down the line? What about those questions to be answered? So in every way possible, it gives you benefit in hard brown cataracts. So again, I think we are skipping a couple of things. This is a very interesting case. We have done the flax through an ICL. There's an ICL with the cataract. The flax has been done through the ICL. So that also works. So the flax is done, the ICL is still in place. Then you can proceed to take out the ICL. The usual method, yank it out. Hand over hand. Then proceed with the cataract surgery. So even in this kind of a situation, flax works. So I'll take it here. This is showing the flax procedure. Let's not go through that. This is again to show in an absolutely mature cataract. As you crack it, the bubbles come out. How did the bubbles get in there? Because the laser was able to penetrate even through an almost opaque cataract. So it works in that too. It's invaluable in subluxated cataracts and PPC. There's no way you can compare it to that. So we have a PCC. In a PCC, we prefer not to do softening, just do the segmentation. So that makes it easier. You can even do a very, very gentle hydrodissection because the lens, the gas has already done a hydrodissection in a different plane. It doesn't go down to the bottom. So then you can start taking out the pieces very gently. The separation is good. You don't disturb the posterior plaque. We'll speed it up because we don't want to waste time for the next session. Yeah. So out it comes. So that plaque that was sitting there was not disturbed by the flax. So phaco, what are the aims of phaco? We want less energy, less turbulence, less fluid, less time. And flax gives you every one of these. So it's faster, gentler, less trauma, less turbulence, better endothelial survival, less stress on the zonules. So in every way that it goes, it is good. We have heard statements being made in the past. As a first-year DOPG, I attended my first AIOS when we had an absolute, what shall I say, guru of ophthalmology stand up during a plenary session, and the exact words, it echoes in my mind. Please, please do not put this IOLs into human eyes. That was exactly in 1984. In 84, it was thought that putting IOLs into the human eyes was an abomination. Today, what are we doing? Do we still carry that forward for everything that comes different, a new technology, just because it's expensive? I've seen surgeons of today, top people, who will deride a technology saying, femto flap is nothing, it's useless. A bladed flap is equally good. Until that given surgeon buys a femto machine. Then suddenly femto flap becomes great. That's pathetic. The improvements we're looking forward now are not large steps. Large steps are over. These increments are tiny. They are millimeter or micron levels of improvement. But outlandish amounts of money is being spent to get that small amount of improvement. That can be debated, but don't deride the technology and turn it down. Any technology that's come forward should be evaluated, looked forward dispassionately, and taken up, even if it hurts you, just for the sake the technology is better. Thank you. I think that'll do. We'll wind up before the other people throw us out.